Good morning, students.
Good morning, ma'am.
Morning, ma'am.
Morning, ma'am.
Good morning, ma'am.
Is everyone present?
Morning, ma'am.
Okay, for today's class, you'll be having complications of dialysis. The topic is complications of dialysis. Okay, so from the word complication, what do you understand from the word complication? What does it mean? What do you understand by the word complication? Yes, anyone?
Problem.
What do you understand by the word complication? What does it mean? Does anyone know? Yes or no?
No, ma'am.
Complications means difficulty or problems. Means complications of dialysis are the problems that you'll be facing during dialysis. Okay. Yes.
Okay.
Understood, everyone?
Yes, ma'am.
So what does complication mean?
Problem facing during dialysis.
Okay, I want everyone to tell me what does complication means. Loud and clear.
Difficulty, problem.
Ma'am, difficulty.
Yes.
Problem.
Difficulty or problems faced during dialysis. Okay.
Dialysis.
And I'll tell you what are they. And then once you go for your hospital duty also, you'll see all of these that some patients will be facing. Okay. So your first is hypertension. And what is hypertension? Hypertension is low blood pressure.
No.
Okay. So like during dialysis, patient undergoing hemodialysis, okay, they're mostly at risk of developing sudden drop of blood pressure. Okay. Understood? Patient undergoing hemodialysis are at risk of developing sudden drop of blood pressure. During this, means during the dialysis process, when you're doing the hemodialysis, hypertension can occur. And what does hypertension means? What does hypertension means?
High blood pressure.
Pardon?
Low blood pressure, ma'am.
Yes, hypertension means low blood pressure. So is that point understood?
Yes, ma'am.
Yes, ma'am.
Hypertension means low blood pressure, and patient undergoing hemodialysis, okay, they're at risk of developing sudden drop of blood pressure during the procedure of dialysis. Okay.
Yes, ma'am.
So that's your first point. Is that point clear?
Yes, ma'am.
Yes. Okay. So and the next is anemia. What does anemia means? Hypertension is low blood pressure. What does anemia means?
Ma'am, lack of blood.
Yes.
Level of
Lack of red blood cells. Okay. Anemia means lack of blood. Okay. Red blood cells. Okay. So that's your second point. These are the problems. These are the problems you can say. Complications means problems. So these are the problems you'll be facing. You'll see in patients that are undergoing hemodialysis. These are the complications or the problems that they'll be facing. Okay. And your next is muscle cramps, nausea, vomiting. Okay. Next is muscle cramps, nausea, vomiting. So again, muscle cramps usually occurs when the dialysis is almost over. When the dialysis is almost over means to the end of the hemodialysis, patient usually get muscle cramps. Okay, not everyone, depending on patients, depending on the condition of the patient. Okay, It's not that every patient will face these problems. Yes. So many patients will experience muscle cramps, nausea, vomiting, okay, headache during dialysis. This is common. Nausea, vomiting, okay, diarrhea. Most of these are common. You'll see in many patients. Once you go to hospital duty, when you come, you'll see all of these. And this occurs due to sometimes in case of the mixture, like the mixture of the dialysis. Okay, if it's not properly mixed, or else it can also be due to the ultrafiltration. Okay, due to the ultrafiltration rate, this can also occur if it is not proper. And all of these occurs in the middle of dialysis or to the end of dialysis. Means like when it's all about to end, because your dialysis is 4 hours, so it may occur 1 hour before it ends or half an hour before it ends. It can occur anytime. Okay, understood?
Yes. Yes, ma'am.
Yes or no? Everyone, yes or no?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. Next is headache. Headache, it's common. You all know what headache is. Do I have to explain what headache is?
No, ma'am.
Everyone knows, right, what headache is?
Yes, ma'am.
Okay. So headache is one of the problems, and chest pain again is the next. Okay. And this chest pain, it occurs during okay, all of these occurs during dialysis. So it may be associated with hypertension, which means low blood pressure, and also hemolysis. What does hemolysis mean? Hemolysis means the breakdown of what? Red blood cells. Okay.
That's it.
These are associated with, your chest pain is associated with hypertension and hemolysis. That's your next. And then next is itching. So during dialysis, itching can also occur during the procedure. And this also, it happens only in the middle of dialysis, never before you start your dialysis, or never like in the beginning of the dialysis. Okay. And what is next? Itching. Again, back pain. Back pain is like, obviously it's for every patient, because you're sleeping there in the same position for 4 hours. So obviously you'll feel the pain. You cannot move your hands, you cannot move your legs. You have to be stable. So back pain is common for every patient. Okay. Yes?
Okay. Yes, ma'am.
Yes or no? Understood or not?
Yes, ma'am.
Yes,
Back
ma'am.
pain.
Yes, ma'am.
Okay. And again, fever and chills. Some of them will be having fever during dialysis. They'll be feeling cold. Okay. And in some cases, if the chill means, chill is when you're shivering, when you're feeling very cold and you're shivering. And if it's too much, then medicines will be given, or else injection will be given, depending. The nurse in charge will be there to see. Okay. So again, there will be fever and chills during dialysis in some patients, not every patient, in some patients, depending on the condition again. And then your next is hemolysis. What is hemolysis? What did I say? What is hemolysis?
Breakdown of
Breakdown of?
breakdown of
red
red blood
Breakdown
cells.
of red blood
Yes,
cells.
it's a breakdown of red blood cells. Okay. And this, it may be present, or it may cause chest pain or tiredness. Means you'll feel the chest pain, tiredness, back pain. Again, hemolysis, all of these come under this chest pain, back pain, and tiredness. All of these comes under hemolysis. Okay. So even I kept chest pain, I kept back pain in your points. But if you just write hemolysis also, all of those come under hemolysis. Okay. And if what do I say? If not recognized early, if you do not recognize it early, it can lead to severe hyperkalemia that can cause death. Okay. It can lead to severe hyperkalemia that can cause death. What does hyperkalemia means? What is hyperkalemia?
High level of potassium.
Yeah, high potassium level. Okay, hyperkalemia means high potassium level, and hyperkalemia may be it may be caused due to poor nutritional intake, and then when there's excessive loss can be like diarrhea, can be vomiting. Okay, that is excessive loss when you're going passing stool too much or is vomiting too many times. Okay, that can also lead to breakdown of red blood cells. That is, that can lead to that can lead to hyperkalemia. Okay, what does hyperkalemia means again? High potassium level, and it may be caused due to nutritional intake, okay, and excessive loss, like continuous passing of stool and then vomiting, diarrhea. Okay, that is hemolysis. And next is arrhythmia. And you have about arrhythmia yesterday, I think so everyone saw the message I've sent. What does arrhythmia means? What does arrhythmia means?
Irregular heartbeat.
Improper?
Irregular heartbeat.
Okay, irregular heartbeat. Got it, everyone? Did everyone hear that?
Yes, ma'am.
Okay. Arrhythmia means irregular heartbeat. Okay, the heartbeat's either too fast or too slow. It can either be too fast or too slow, and your heartbeat shouldn't be. And during dialysis, it shouldn't be that way. It should always be normal. So in that case, you have to check. In some patients, the heartbeat is too low, and in some patients, the heartbeat is very high. Okay, that is arrhythmia. And next point is, understood what arrhythmia is?
Yes, ma'am.
Okay.
Yes, ma'am.
So
Yes,
what does next is air embolism. What does air embolism means? Anyone? Yes or no?
No.
Okay. There's a blockage of blood supply. Okay, there's a blockage of blood supply caused by bubbles in the blood vessels or the heart. So during dialysis, while you're doing the procedure, while you're doing the priming procedure, you'll come to know what priming is all about. Once you start with your priming procedure, you should always make sure that in your dialyzer, okay, there should never be bubbles. Means like when the NS is flowing, because before doing dialysis, you'll have to perform your priming procedure. Okay. I'll tell you about when the syllabus is over, I'll tell you what priming is all about. You'll come to know in your final semester also. It's there in your syllabus. So during your priming procedure, you should always make sure that in your dialyzer, there should never be bubbles. There should never be air inside. So when you're doing a priming procedure, you should always make sure that inside the dialyzer, there is no more bubbles. Because again, during dialysis, if there's bubbles, then what will happen? There will be blockage of what?
blood supply.
Yes. If there's air bubble, if there is air bubbles, there will be blockage of blood supply. Okay. So you should always make sure that there's never bubbles in the dialyzer, or else in your chamber, your blood chamber, there'll be two blood chamber. There also you should make sure there's never bubbles, because once bubble is there, there's a chance of clotting. There's a chance of clotting. Okay. There are chances that your blood will clot. So you should always make sure there's never bubbles, and that is called air embolism. Okay.
Yes, ma'am.
And during your hemodialysis, if that happens, you should always remember to clamp all your, means like there will be clips in your blood tubings. There will be clips. There'll be a blue line and a red line, so there will be clips. You should always remember to clamp and stop the blood. But clamp all the clips first and then stop the blood pump. Okay. This part of it you'll not understand, but once you go to hospital duty, remind me. I'll tell you what this is. Okay.
Yes, ma'am.
Okay. So is that point understood? Embolism.
Yes, ma'am.
Yes, everyone.
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Yes, ma'am.
Your next is fluid overload. What is? Have you ever seen a patient going for dialysis? Yes or no? Have you ever seen any patient going for dialysis?
No.
No. In every patient
Yes,
going for
ma'am.
dialysis, many people will have edema, that is fluid overload. I mean, if you just touch the feet or the feet area, usually if you just press, you'll see there will be the mark that you press there. It'll be there. It'll remain because of the fluid, because there's so much fluid in the body. Okay. So fluid overload also will occur. They will face this problem. Many people going for dialysis, means having kidney problem, have fluid overload. Okay. And your last point is electrolyte imbalance. What does electrolyte imbalance means? Anyone? Yes or no?
No.
So electrolyte imbalance is when the electrolyte level in the blood, okay, are too high or too low. When electrolyte level in the blood is too high or too low. Okay. And then what are the symptoms? The symptoms, your symptoms for electrolyte balance can be irregular heartbeat. Okay. Irregular heartbeat, the nausea, vomiting, and diarrhea. Okay, those are your symptoms. Electrolyte imbalances. What is electrolyte imbalance? When the electrolyte level in the blood is what? Too high or too low?
Hello.
It shouldn't be too high, it shouldn't be too low. Okay.
Okay.
And what are your symptoms? And what are the symptoms for electrolyte imbalance? What are they?
Nausea, vomiting, diarrhea.
Irregular heartbeat, nausea,
Yes.
vomiting,
Nausea,
diarrhea.
vomiting, irregular heartbeat, diarrhea. Okay. So those are your complications of dialysis. And I'll send you your notes. Your notes are just in points. Just so your first, what are the complications of dialysis? What's your first point? First point is hypertension.
Hypertension.
Second is anemia. Okay. Third is muscle cramps, nausea, vomiting. That's your third point. Fourth is headache. And your fifth is chest pain. 6, itching. 7, back pain. 8 is fever and chills. 9 is hemolysis. 10 is arrhythmia. 11 is fluid overload. And the last is electrolyte imbalance. Yes, got it, everyone?
Yes, ma'am.
Is that okay?
Yes, ma'am.
Yeah, I think that should be okay. You all understood this point? I mean, all of these points?
Yes, ma'am.
So, okay, so that is your complications of dialysis. And for your next class will be tomorrow, and I'll be taking anticoagulation. Okay? Yes?
Yes, ma'am.
So everyone understood?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. And everyone, please try and be regular for your class. I've seen many of you not being regular. Sometimes I have only 21 students. Sometimes at the end of the class, I have full attendance. In the middle of the class, I have only 20, 18, 17 students. So make sure you're always on time for class. Okay. Okay, thank you, everyone.
Thank you.
Thank you, ma'am.
Ma'am.
Thank you, ma'am.